All right, welcome everybody to the second segment of our virtual info series. And so with us today, we have Sanford Good Samaritan. What's the last part of it on there? I got the first part correct, right? Sanford Good
Society.
Samaritan Society. There we go. And so they're going to talk to you a little bit about their organization, what opportunities they have available, and how you can get involved. So Carly Kaiso. Dang it.
Kiso, yeah.
Kiso. Okay, oh, I had it. Okay, perfect. And so Carly Kiso will take us away with that information. And if you have any questions, there'll be time to do that towards the end. All right, take it away.
All right, sounds good. I'm just going to share my screen here and get started. Okay, so this is just kind of a brief overview of Sanford Health and Good Samaritan Society, kind of like it was mentioned in the beginning here. So right off the bat, a little bit about who we are here at Sanford Health and Good Samaritan Society. We are a rural brand. So with that, we kind of work in more of those rural type areas. Our vision is improving the human condition at every stage of life through exceptional care, spiritual enrichment, innovation, and discovery, kind of with being a rural brand that really branches into that innovation part. Having build up kind of with limited resources. So very top notch, kind of working with those remote relationships. A little bit about our mission statement. So dedicated to sharing God's love through the work of health, healing, and comfort. Good Samaritan Society actually is a religious based organization. Kind of how it started, it was two priests that were asked by a family. They just needed a little bit of help taking care of their son. And from there, they did a little bit of fundraising and actually got more than they anticipated. So, with that, they actually built Good Samaritan Society. So, that's kind of where that religious part comes in. However, it is not specific to any one religion. Anyone is welcome at Good Samaritan Society and Sanford Health. Right. So, a little bit about who we are again. So, we are one of the largest not for profit rural health systems in the United States, kind of like I mentioned, that rural health system. We do have over 50,000 employees here at Sanford Health and Good Samaritan Society. That is including our 44 medical centers, our 482 clinics, as well as 200 long term care and senior living facilities. The Good Samaritan Society half is kind of more that long term care and senior living. And then Sanford Health is more the medical centers and clinic portions. So a little bit about our biggest regions at Sanford Health. Bemidji, Minnesota is kind of in that northern Minnesota part. And then we have Bismarck, North Dakota, which is kind of more central North Dakota, Fargo, North Dakota, and then Sioux Falls, South Dakota. These are actually two of our bigger facilities. Fargo and Sioux Falls are our only research places. And Sioux Falls, South Dakota actually is where we are headquartered, and that is our largest facility. So Fargo and Sioux Falls do a lot with, like I said, research, a lot of different internship opportunities there as well to help out with that research. All right. So I know there's a lot of different majors kind of listening to this and all that. So I kind of wanted just to go over some science-based careers. So if you are a science major, we do have a lot of different opportunities for you here at Sanford Health and Good Samaritan Society. We have physicians, physical occupation therapies, different type of nurses that you can specialize in different skills there. Lab techs, this kind of needs a certificate as well. Phlebotomists, these are more in our Sanford Health regions. Researchers, like I kind of said, that research is kind of more Fargo, North Dakota, and Sioux Falls, South Dakota. So dependent on what kind of research you are looking to do, that will vary on the locations that you can choose from. And then we have pharmacies as well. A little bit more for the engineering majors in the room. We do have biomedical research, again, paying attention to where that research positions are open at. We do a lot with prosthetics at Sanford Health side of things, making sure things are properly fitted and working the way they should. Computer engineering. So a lot of the medical equipment design is cutting edge here at Sanford Health, and we're always looking to push past that, getting better each and every day. And data analyst, logistics, and supply chain. So making sure everything is getting here on time and working kind of the way it should. So for upper opportunities, if you weren't a science major or engineering majors, we do have a level of opportunities for business majors. That is myself. I actually was a business major, and now I work in human resources. We have different career opportunities for IT majors, whether it be kind of more the computer, IT security roles, or general IT. We have different food service opportunities, security, even with a specific major, you don't need to do one specific role. With Sanford Health, you can kind of flow into different positions, kind of wherever you're looking to grow your career. We want to help grow with you. So you can take it a lot of different ways. So a little bit about Sanford Health today. The blue states are actually where we have locations in. This is including Good Samaritan Society and Sanford Health. We do serve around 2.74 million people across 300 communities. As you can see, it's a large majority of the US. Also not pictured on here, we do serve Hawaii as well. They just weren't on the map. Within this, we again have 44 medical centers. We average around 6.1 billion in annual revenue, 482 clinics, 242 senior living facilities. Again, those senior living facilities are more on the Good Samaritan Society side. And then around 190,000 Sanford Health Plan members, around 1,500 physicians, 1,000 advanced practice providers, and around that 9,703 registered nurses, always looking to bump those numbers up and get a little bit more nurses in our ranks. We do have a lot of different specialty areas. So if you are a nurse looking to get into a certain specialty area, we can help you out there. We have over 80 specialty areas. A little bit about what Sanford provides to those 300 communities each year is 5.3 million outpatient and clinic visits, around 85,000 admissions each year, 1,336, 1,000, well, excuse me, 136,436 surgeries and procedures, around 10,000 births in our Sanford Health clinics, and around 210 emergency department visits. And then you can kind of see the little globe that's pictured in Oregon, California, and Oklahoma there. Those are actually our World Clinic locations. A little bit more on our World Clinics. If you're looking to get a little travel internationally, you're a nurse and wanting to get a little bit more experience, there are different opportunities for that as well with our Sanford World Clinics. We have all these different locations where you can actually travel there to work. And I know it would be super awesome being able to travel internationally for my job. So you can kind of explore, great for kind of newer students that aren't so set in their career yet, looking to get these different opportunities. So it's a very, very cool program. All right, so a little bit about the different initiatives here at Sanford. Our first one here is actually on the cutting edge, making those steps forward, kind of like I mentioned, we're innovative. Working with primary care for adults. It's kind of the first program of its kind in the nation. It is helping people with their health concerns before those health concerns become maybe more deadly. It's getting them in the hospitals before that. The Sanford chip process help with that. It's kind of like in those movies that you kind of see those chips that get put into people's wrists, things like that, but it's not anything tracking you or something crazy like that. The second one is Sanford Project, identifying and delivering a cure for type 1 diabetes. Big program wanting to help out those with type 1 diabetes that are born with it and those other health risks that come along with it. The third initiative here at Sanford is the Edith Sanford Breast Center, advancing today's prevention and treatment for that, looking to kind of end breast cancer for the future generations. All righty. So kind of more into getting your career started and as well as the job search process. A couple of different things to remember when looking for a job is your resume is typically the first step. When doing your resume, you want to keep in mind the job that you're applying for. What I like to do is go onto the website and kind of match up the qualifications that they're looking for with your resume. Maybe there's something in the qualification that sparks you and say, oh, I didn't think to even mention that on my resume. So it's always good to list those, showing you have that previous experience on there. And then when you're actually applying, after that typically comes the interview stage. Interviews can look a little bit different nowadays, kind of due to the whole virtual interview process. Sometimes you never know if it's going to be an in-person interview versus a virtual interview, and they both are very different processes that you have to make sure that you prepare for. And typically after the interview is your offer stage. If an employer does give you an offer, it never hurts their feelings or anything like that. If you need a day or two to think about it, a new career is a very big life-changing step. And maybe, you're first starting out your career and you're kind of nervous, you're not sure what area you want to go into. Always taking that time to think about it is good.
And one thing I
Uh,
would mention, Carly, real quick, as far as just the process, it's always a good idea to keep a journal of some kind or some type of a map of what you've done with a certain employer. I always recommend writing down the job that you applied for, the email that you used when you applied for the position, the deadline for that particular application to go through in case you are applying to multiple places, as well as any detail about the position that you think is going to be very important when you're tailoring your resume. So that way, as you go through that process of setting that up before you submit that to that employer, you're already thinking of, stories that you're going to talk about or things that you're going to mention as part of those job descriptions of your previous experience and how they relate to the job that you're actually applying for.
Yeah, thank you. Great. Good mentions. For sure, kind of piggybacking off of that with the application process, like I kind of mentioned before, looking at those qualifications and interests, you want to make sure that you have a good amount of interest in the positions that you're applying for. Sometimes looking for a job can get a little bit overwhelming and you're not keeping your true self in mind of what you're truly interested in. So just making sure that you have interest in the position as well as the qualifications. Um, Kind of doesn't matter if applying for a third party site, kind of like Indeed. Typically, it doesn't matter for any employer. They they are usually quite well integrated. So even if you do apply on an site like Indeed, it is going to sparse over to the employer's page. You can always give them a quick call, make sure that they did get your application. Sometimes job scraping sites such as that one are lag a little bit. So it can kind of cause frustration for the candidate applying as well as for the employer. So giving you a quick call or sending an email asking if they got your application is always a good step. Flexibility as well is very important, especially if you have a very specific job you're looking for. Sometimes that's not just going to be right in your backyard. You are going to have to travel a little bit for that position, especially again, if it's very specific, you know what you want, you know what you're looking for. So you might have to have some flexibility on that, as well as what shift you are working. Especially for new grads, if you are right out of the gate, you might not get your ideal shift right away, but having that little flexibility in the beginning can lead to a lot. Monitoring your phone and email, just making sure if someone is trying to contact you from that position that they are able to get a hold of you. So kind of like Casey said, really writing down what you applied to, when you applied to it, making sure that you're monitoring it so you're not going to miss any of their emails or phone calls. So a little bit about what we can offer you here at Sanford Health. We do offer a full benefit package for full-time and part-time employees. This does include, health, dental, vision, PTO, so paid time off, getting paid to not go to work. That's always a great perk. 401k programs, short and long-term disability, and different employee perks that we work with. Being a Sanford Health and Good Samaritan Society team member does work with kind of local area businesses to get you a good discount on some things. A little bit further than that, especially for new grads, there are different scholarships that we can offer through our positions, kind of depending on what position you are looking for. We do have mentoring programs throughout our facility. So you get paired with someone, they help answer your questions, help you really get to know the role itself. There is a lot of different internal growth opportunities as well. We try to make it easy as possible, trying to do those internal growth opportunities, making sure that there is that next step in your career for you at Sanford Health or Good Samaritan Society. We also do have a great work culture, always promoting that fun attitude, but also a level of seriousness in it, especially in the healthcare field. There is a lot of, serious things you have to take in consideration with people's family. Right. So a little bit of how you can connect with us if you would like. We do have separate social medias for our Sanford Health and our Good Samaritan Society. Kind of like I said, our Sanford Health is more our hospitals and clinics, and then our Good Samaritan Society is more assisted living or skills nursing facility for long-term care. We have Instagram, Facebook, Twitter, LinkedIn. So you can always just give us a follow. We do post quite regularly on there. Whether it be events that we're hosting, different job opportunities in the area that we are getting prepared for. All right, so a little bit of how you can apply if you are interested in the positions. Our Sanford Health and Good Samaritan Society both are on the same website. It is at visitsanfordcareers.com. If you do have any questions, after this, you can always call for assistant, our employee service center. So they are open 7 a.m. to 6 p.m. Monday through Friday. You can give them a call there at that number or email them. One quick shout out about that. It's not just going to be one specific person that answers your question. It's going to be the very top person that knows the most information for that role. They're going to answer your question just so they have the most information and we get your question answered as much as we can. So kind of on that note, is there any questions from anyone at all? I know we kind of have a smaller audience, but any questions out there? No?
I have a question. Just
Yeah.
kind of throwing some ideas out there. What are some things that probably students should probably prepare for to make themselves a good candidate for the opportunities you're looking for? What are some things they could probably do beforehand? Any ideas?
Okay, yeah. So when they're kind of prepared to be a great candidate for us, kind of like I said, really make sure that your resume is no spelling errors, simple things like that. No spelling errors, your qualifications are all listed on there. Any bit of experience helps, whether it be an internship, a volunteer opportunity, even if they have no, exact career work experience, those other experiences, even a group in college that they're in, those are always great to list on there as well. And Casey, I don't know if you have anything to add to that question.
Yeah, so what I would add to that is there really is no bad time to start working in healthcare. And so one of the things I always like to really talk about with college students is the fact that you can be actually working for us now. You can be working in support roles, you can work in entry-level positions where you're getting a chance to network with the company that you intend to work for full-time in the end. And so it's always a good idea to think about if you're moving into something in healthcare, in addition to having the degree or having the know-how to do the position. A lot of what is great about working in healthcare is a lot of the people develop certain characteristics and certain skills that help them to really establish a sense of empathy or a sense of support for the clients that they work with. And that's something that isn't always taught. It's something that you almost have to experience and learn on the go. And you can learn that in an entry-level position. You can learn that working in our kitchen, in a nursing home facility. You can learn that working as a CNA, even if your intent is not necessarily to be a nurse, but to end up being a doctor in something. A lot of those types of things are learned on the job, and those are things that you can be doing now as a college student. We do have positions that are PRN or part-time positions. PRN basically means you're plugged into the schedule as needed. They typically are about 12 to 18 hours a week, and so they really work well with a college schedule. So just a heads up there, it's always a good idea to get involved early. The other reason I mention that is when Carly talked about scholarship programs, that we offer. Typically, those are offered once you are an employee. And so, yes, you can use them to further yourself and to get like a master's degree or a PhD while you've graduated from your bachelor's program, but you can also be using them for that bachelor's degree. So if you're a part-time or full-time employee, you can qualify for those scholarship dollars while you're going to school to finish your bachelor's. So if you're worried about student debt as of right now for the next 4 years of your schooling, those are some great assets to tap too, in addition to obviously a paid job that you're already utilizing. So but as far as the application process, yes, you know, again, interviewing skills and stuff like that, it's stuff that you unfortunately you don't use a lot, but when you do have to use it, it's very important. And so because you don't practice at it a lot, it's kind of nice to every so often just kind of test the waters, submit an application, you know, produce a resume so that it's tailored for that particular position. And you definitely do want to get a job that you love doing and not just a job in general. And so knowing everything about that position, getting a chance to do a little bit of research is always a good idea. And Indeed and ZipRecruiter and all these other third-party sites are great to find those opportunities. But just so you know, there are algorithms working in that. And so as you're looking at positions, as you're opening up a position or saving it, that algorithm is going to start noticing that. And it's only going to show you positions that are related to that. So what I would say is it's always a good idea to also know, does that company have an external site that you can look at to see all of the positions that they offer? Because you might actually miss out on a great opportunity because it's only showing you on those sites exactly what you've saved in the past. So you might miss that diamond in the rough.
Okay.
Anything else? Any other questions?
Okay. Well, thank you guys. Well, thank you all for attending today's info session series. And I want to thank the guests for, making time available to let us know their opportunities. And I mean, again, thank you. This is invaluable information. And so for those who are interested in the next segment, next week, Tuesday, we'll have Northwestern Mutual Financial for segment 3 of our virtual info session series. And so again, thank you all for attending and appreciate your time. Take care.
Have a great day.